Thanks, Rinky. Can you all hear me okay? Yep. Kia ora koutou, kia ora ana, talofa lava, malo e lele. I'm here today to introduce you to the fifth and final Healthier Lives project that was funded by the Challenge in the first tranche of funding. Those of you who've seen my name on the program and are possibly still wondering how to pronounce it and are looking at me now are probably wondering what I'm doing introducing a project that is focused on Māori and Pasifika in New Zealand and supporting healthy lifestyles for them. So I want to start by acknowledging the fact that I, and in fact the project as a whole, would not be here today were it not for the wise stewardship initially of Dr. Lisa Tamaranga and Dr. Riz Firestone, who unfortunately just had to leave a short time ago. But now really the stewardship of the whole project team. So let me introduce you to our project team. Our team is large. It spans almost the whole length of the country, from the University of Otago in Dunedin through to Massey University here in Wellington. Waifitu is one of the communities here in Wellington that's involved, all the way up to Tokoroa for the Pasifika communities that are involved in the project, the Whānau in West Auckland, and as far north as Helensville with Ngāti Whātua. I particularly want to acknowledge, in addition to Lisa, who's here today, Jackie Gray and Sally Dalhousie, because I'd like to be able to direct some of the really difficult questions to them later on. And for those of you who prefer faces to names, I just wanted to show you who our team are. So these are some pictures. The one on the top left-hand side is our Pasifika team at a recent team hui that we had. Akariri, Sally, Tavita, Riz, and Omati. And the one on the top right is most of our Māori research team, but not Lisa, who'd just had surgery and wasn't able to join us for that. Leonie Matoi is there in that picture. Some of you will know that Leonie has recently left Toi Tangata to return to Taranaki to do some work with her iwi there. So at the moment we're in the very capable hands of Callie Corrigan, who's standing in for Leonie whilst they appoint a new CEO. I'd also like to particularly point out, oh, excuse me, I was trying to find the... Debbie Goodwin is a Māori PhD student who's based in Hamilton but has just started on a PhD at the University of Auckland within the framework of this project. Rangi Marie Mules, whose name I saw on a previous slide actually, but Rangi Marie is providing guidance to us in terms of co-design methods and supporting our Māori and Pasifika teams in terms of the kind of methods and processes that are used for co-design. This is Crystal and Janelle, who are community coordinators in Waifitu and Ngāti Whātua. And the picture at the bottom includes some of our wider research team as well. So what is the WellTEXT project trying to do? We are aiming to develop a culturally tailored mHealth or mobile health lifestyle support program for Māori and Pasifika. The program is being co-designed with the communities that you saw in some of the earlier pictures, and I'll return shortly to what co-design means in the context of this project. And the plan then is to evaluate it using a really innovative randomised control design called an adaptive trial or a SMART trial. And the idea of those kinds of trials is that as people progress through the trial, depending how they respond to an intervention, the intervention can either be augmented or they can switch to another intervention if they're not responding. We will be doing a process evaluation, and that's something that is going to be the focus of Debbie's PhD, actually. And we're also going to look at options to link our trial data and data that are collected, if we use a smartphone app, into the VHIN that you've heard about earlier today. So we are talking about a mobile health program in this project. it is being co-designed, so we don't yet know exactly what the program is going to look like, but I really wanted to give you a feel for some of the features or some of what it might include. So a mobile health program will typically include any or all of the following elements. So it might be text-based, might use SMS text messages. So for example, the quit line that we've heard about earlier uses text messaging to support people who are quitting smoking. It might be a web-based or a mobile phone-based app, and some examples of those here in New Zealand and that we've developed in NIHI include the Food Switch app to help people make healthier food choices, and also the Sparks program, which is a kind of a gamified web-based application aimed at teenagers with depression. But these kind of programs can also include personal data, biosensor data. It can be from something as simple as a pedometer or indeed a Fitbit, which we heard the Minister talking about earlier, to more complex biosensors that measure things like our blood glucose and blood pressure. These kind of programs can also include elements of social support, and in fact they appear to be particularly important for a lot of people to actually stay engaged with these kinds of programs. And there's a whole range of motivational tools that can be used as well to also maintain engagement. So I've mentioned the fact that this is a co-design project with Māori and Pasifika communities, and co-design, it's quite a buzzword these days, and I think it's being used a lot, maybe without people fully understanding what it means. But it is an approach to design that has come largely out of technology, but is also being increasingly used in our health sector as well. And the idea is that it actively involves all stakeholders in a program, project, or intervention. So particularly communities, end users, citizens, and so on. And the idea is that in doing that, we can make sure that our end result of our research is really meeting the needs of the users, and that it can be used and will be used by them. It shifts the focus from technology to people. There was a little bit of discussion earlier about how people get really excited about data and think, oh, we've got all this data, what can we do with it? I think the same is really true of technology. People go, oh, technology is amazing, let's just develop an app. But actually we have to start with people, and we have to start with what people want and what they need, because that's the only way that the technology is going to be useful in their lives. The ultimate aim is that the users design the solutions themselves, and that we as researchers adopt a supportive role rather than a more traditional directive role. There's a process that goes all the way from beginning engagement with end users and stakeholders all the way through to evaluating the outcomes of the research. So the text that's in the three speech bubbles up there relates to the planning, exploring, and developing phase. So the planning phase is where you start work with users to establish what their goals are, and then move on to exploring what their needs and experiences are. And that's very much the stage that we're at in WellTEXT at the moment, engaging with the communities, finding out about their hopes and dreams, what does a healthy lifestyle mean to them, and understanding their experiences. And it's really only when that's done that we can turn those ideas into possible interventions. And the idea is that hopefully we have lots of possible interventions, but that we then decide on one potential intervention or program, and which we will then hopefully go on and evaluate in healthier lives. So what will we get out of the project? In the short term, I think we will understand a lot more about lifestyle behaviour change and what features and elements of that Māori and Pasifika in New Zealand particularly want help and support with. And in terms of technology and mobile technology, what elements and features they particularly like and would like to see in programs. In the short term as well, we will have some understanding of engagement, uptake and use of the program by communities in New Zealand. Longer term, obviously, we aim to evaluate the effects of the program on NCD risk factors. This is a challenge that is about reducing risk for heart disease, cancer and diabetes. So we do want to see what impact this program can have on risk factors for those diseases. We also want to look at the potential to scaling it up for national delivery. If it's effective, we'd like to see this as something that might be rolled out along the lines of something like the quit line, the stop smoking SMS service. And I mentioned earlier that we'll also look at potential to link to some of those other sources of big data. So what's our project timeframe? We have two main phases. At the moment, we're in the co-design phase. It only started in April, so we're only 6 months into the project. And we did spend a large part of the project initially meeting and engaging and then formally partnering with the communities who are involved in the project. Then there was a phase of co-design training for the community facilitators and the project team, and that's been led by Rangi Māori Mules. And at the moment we're in the co-design phase, actually working with the communities and understanding what their needs and wants are. And taking feedback from those communities, bringing it back to Team Hui to understand what that means, and then understanding how we then go back to the communities again to find out a little bit more about helping us move along in this path and process. We are planning that by the end of this year, early next year, that we will be in the design phase. So we'll be working with graphic designers and developers to actually develop the tool and develop a prototype so that we can then, so that the communities can test and provide feedback and refine that tool before it's ready for evaluation. And the second phase, the trial phase, will start in April. But we'll talk more about that maybe at future Kōrero Tahi. Again, some pictures from some of our co-design Wananga. We've held them in various locations around the country. The picture on the top left, that was in Oraki. And this was where mostly the Māori team and also the university researchers got together. Here we had, this was a hui, a whānau that we held in Hamilton with the Pasifika team where Rangi Māori, this is Rangi Māori, came and provided training for the team around co-design, what co-design is, and provided guidance on a whole range of tools and techniques to do a lot more than just the traditional focus group techniques and tools that we're also familiar with, but more innovative ways to really think outside the box and encourage people to think outside the box about what kind of solutions might help them in gaining healthier lifestyles. So we, as I said, are very early on. We've only had one team hui where we've provided, or where we've looked at some of the emerging themes that came from the first community hui run by the whānau and in South Waikato. And these, I think, won't come as a surprise to anybody here today. In fact, they resonate very well with some of what Andrew and others were saying earlier today. Some major themes that were coming through is that haora, or well-being, is not just about the physical for Māori and Pasifika, that we really need to be thinking in terms of mental, emotional and spiritual health as well. That whatever we develop needs to be whānau or family-centred, not just about an individual. I think we probably all could have guessed that there are generational differences in terms of the kind of technologies that different age groups engage with and might use. So that's something that we have to be mindful of moving forward. There was certainly a lot of strong feedback from the communities that they saw their cultural values and traditions as a really positive vehicle for change. and that they saw that as something that would be really important to bring into any kind of program. From some of the health workers that were involved in some of the early hui, certainly an emphasis on using Māori and Pasifika health frameworks to guide the development of content and interventions. And feedback from the communities that we do need to be aware of the very real barriers they face. So we may develop programs to help individuals, but we do have to be aware of the context and the environments that they live in. So, for example, how easy it is for them to access healthy foods, and understanding things like health literacy and you know, the understanding what kind of information is available out there. So, what have we learned so far? I guess it sounds blasé, but actually this is very real. Co-design requires strong relationships, and building good relationships takes time. And you might go, yeah, okay, we know that. But actually for research, that's really challenging, because it's hard to build time into a traditional research project to really develop good, strong working relationships that mean that honest, open, transparent discussions can take place, and that a group can continue to work together over time. So I think, you know, that's a real tension that, you know, if we go down this co-design route more in research, we somehow need to build that time in. So the second point, I guess, is really reiterating that co-design is not just doing focus groups. It is not doing what we've always done. And Rangi Maria is very good at bringing us back, and when we tend, as we often do, to just fall back into doing what we've always done. We want to do more with co-design. With a very large, diverse team like ours, we've certainly learned that we need to think outside the square, we need to be flexible, we need to use technology to communicate. We're getting really good at using Zoom, and I mean, there is no replacement for face-to-face a lot of the time, but our team is very good also at using Zoom and other technology. But probably one of the major take-home points, and certainly feedback that we got from our community so far, is that communities love co-design. They really value having this opportunity to be involved in research projects from the get-go. And they are being so generous with their feedback and their input into the project because of that, because they see this as a different approach to a traditional research approach. So final slide, what are our next steps for this project? We have a second team feedback hui or whānau next week in Auckland. One of the things we want to do there is change the project name. WellTEXT was a placeholder, but some of the suggestions that have been put forward by our team include things like Textola or Textora. Watch this space. There will be a different name. It won't be WellTEXT. As we move forward, we will need to confirm what kind of lifestyle behaviour will be the focus, or behaviours will be the focus of the programme. Our target groups, because of the fact that different groups engage with technology in different ways, and what their preferred features are. I mentioned the fact that we're now getting graphic designers on board and developers to help us actually develop the tool. But ultimately, I think over the next 6 months, what we're really trying to do is create a shared story, bringing together the community knowledge and expertise with the theory and practice of behaviour change as well, with a view to developing a program that Māori and Pasifika can engage with and use to support healthy lifestyles in New Zealand. Thank you.